Assalamu alaikum wa rahmatullahi wa barakatuh. Sister, brother, I'm delighted to be here. Good afternoon to you. So I thought I will have a half an hour to go over my lecture, and instantly, and I was blessed yesterday to see my son Ibrahim, and I was telling him, can you please tie me? And I kept on and on and on and on. And then in the middle he said, Mom, how long this is supposed to be? I said, half an hour. He said, you already passed half an hour. And then come to the morning, I'm looking again for the brother. He sent us this, about the meeting. And I found out it's only 20 minutes. So I'm going to run. I'm going to probably have quite a number of slides. And each slide, probably approximately, I can easily spend 20 minutes. But I won't do that. I'll go through it. And then in the end, we have the questions, and I'm glad that we have that, and you can ask me all the questions during that time and after that meeting. I'm yours. So for this afternoon, so please feel free at that time. I'm going introduction. I think everybody made those introduction about the prevalence of depression worldwide is over 300 million, and it's one of the causes also of leading causes for disability in this country. And so let me go. So you can read that. I'm not going to spend that much time on this because I think we all said it. The second thing, what is the relationship between the nutrition and then depression? And brother just said, he said we already have a plenty of to eat, but I don't know if it is healthy or unhealthy. And then when we distinguish what's healthy versus unhealthy, basically, unhealthy eating behaviors leads to depression. And I'm talking about unhealthy behavior. What's unhealthy behavior? It's all the decisions that is made by group or individual based on where their location, what's availability of the food, what's a preference, sometimes cultural, cults, religion, all dictate what we eat. But and also probably sometimes preference. I don't eat meals. I graze through the day. You hear that all the time. Sometimes I have patients. They tell me I have one meal. I said the whole day one meal. They said yeah, but I cannot lose weight. Well, I can tell you why. Same thing. So it applies for everything, even with the depression. A lot of these things that we do, we are unaware of it. It may lead us to depression. So it's not only the food that we eat, also it's the quality of the food that we have. And we're going to talk through the slides about that. But we have I want you to imagine we have a triangle. We have here the quality of the food that we eat, and then we have the physical here, and then we have mental here. So it's triangle. What we eat affect the physical. What we have with physical affect the mental. And what we have in mental also, it affects the intake and vice versa. How? If you're depressed, are you going to go in and say, I'm going to have a good biryani, and I'm going to use take the chicken, cook it, take off the skin and put, you're going to depress. What are you going to do? Order pizza. Or, oh gosh, French fries and that burger. Oh, Kentucky, oh my God, I need that. Right? That's what you do. The mental affects what you intake. And what your intake, how is going to take your physical? How is it over time? Do you feel tired? You gain weight maybe? Many of the times I see the gain weight. What else? Blood pressure goes up. Lipids, hyperlipidemia goes up. And then also what you're going to do? Take medication. Go to their PCP, give you medication. You take the medication, guess what? They have side effects. Minimum. I don't want to say Lipitor, but statin, for example. I gain weight, I have this, and now I have lipid, I don't want to say the word, but statin, for example. But one of the side effects, and I see it with the statin, what do we have? Muscular pain, okay? Muscular pain. And then they found out even antioxidants like CQ10 depleted from those cells. And then when do they have the patient? With this, I can't do physical, I can't lose weight, I'm gaining weight, I can't do... What are they going to happen? They end up with depression, sadness, and after sadness, depression, being sloppy at work, at things, and it's accumulated. So that's the relationship I wanted to say. Physical, mental, food intakes, all. Mental status can affect food preference, and food preference can affect the mental. So the next slide. So, okay, there was a study that's done. One of the biggest study was done in Spain, and they recruited about 7,500 patients or individuals. Those are healthy individuals that are high risk of cardiovascular disease. So they don't have cardiovascular disease, they don't have heart problem, but they are high risk. And they have like three arms from this research. One of the arm, they gave them Mediterranean diet with free olive oil, extra virgin olive oil. The other arm, Mediterranean diet with free amounts or at least 30 grams of nuts. The third arm, which I used to do all the time, being ICU and CSU, I go to the patient, just have heart attack. I'm like, you're going to be on low-fat diet. What's a low-fat diet? You see their lunch, they're not even touching it. All right? So that's kind of the diet they put them. After 5 years, what was the conclusion? What was the outcome of this? Those patients who followed arm 1 and arm 2. Remember, Mediterranean diet with olive oil, extra virgin, and the other Mediterranean diet with nuts, mixed nuts, they have decreased the incidence of cardiovascular diseases by 30%. Versus, we didn't see anything from the low-fat diet. And they look parameter for lipids were great. If they have insulin resistance for diabetes, great. They're taking olive oil, all that. It's a little bit fatty. No way, any gain weight in comparison with low-fat diet. And then from there, the studies start. Like, okay, so if that has all those parameters, the patients on the physical and cardiovascular disease, you think maybe they have some kind of effect on our way and depression, our mental status, mental health? From there, we got another study in Australia. They call it SMILE study. And from that study is that when they start to say, now we have what they call it nutritional psychiatry. So before psychiatry, just medication, now they are involving in Harvard University and many other centers of excellence where they have what they call it nutritional psychiatry, where actually combination of the diet and the medication. From there, we have the SMILE study. The SMILE study was conducted in Australia. So that was the first one in Spain. This is in Australia. And they found out, so those patients, they did the same thing. They gave them Mediterranean diet and, normal diet, what people having. But those patients, actually 67%, they put them in half. They are between moderate to severe depression they have. So they are in some kind of medication, some of also therapies, psychotherapies. So, but in the end, they were followed by about 12 weeks. And in the end, the findings was, it was amazing. Those patients also who followed the Mediterranean diet, their depression scale decreased. So they were remission, what they say remission was achieved by 32.3% versus those one they were, what they call it, they have like a group befriending. They call it befriending, is like a group support. Somebody talks to them, the doctor, psychologist, social work, kind of that support. They have remission only 8%. Okay? So when I'm talking remission, we're not saying cure, but remission is like, let's say somebody who is in moderate depression, they will be mild. Severe, they will be moderate. And that's a great improvement. If somebody cannot get out of their bed because they're depressed versus somebody, I can get out, I can fix myself a meal, maybe I can go to work too, but under control of the other parameters with the medications. So let's find out what is in the Mediterranean diet makes it is a good thing for us. And how can we beat with the Mediterranean diet can be preventative and can be adjunct with medications and with psychotherapy as well. Let's look at each of them. So as you see here, there's the protein, tryptophan. We had a lot there. The lamb, the chicken, everybody's happy now. Let's find out why. We have the omega, and I'm going quickly through them. And I want to focus in the end the probiotic and prebiotic, because this is the subject. It is the subject, and research is going on about the prebiotic and probiotic. Let's take about the protein. So quickly, proteins, they are divided. The building blocks for the proteins are amino acids. There are essential amino acids, non-essential amino acids. So when I say essential amino acid, essential, what do you mean essential? That I need it from outside. I cannot build it inside. So one of those things I wanted to kind of focus is tryptophan. And tryptophan is associated with the happy hormone. What are the happy hormone? Exactly, the serotonin is the happy hormone. Also, what else? Also, it's involved in dopamine, but primarily it was serotonin and melatonin. So you're happy, go lucky, and also you sleep well. All right? So it does have the effect, the tryptophan effect. And how does the tryptophan have effect on? So all of them are really, it's like a cascade of reactions. They all go together, and each of them, they go together. So tryptophan, we said, is an amino acid, and that will be converted to serotonin. Now, where the serotonin is, we say the happy, right, is a neurotransmitter, important neurotransmitter. Mainly, where is it produced? So, both of you are correct, in the brain and the guts. 10% in the brain, 90% of the serotonin is in your gut. So the gut by itself, it has their own nervous system. It has the neurons make decisions, and there's association between gut and the gut and the brain. Okay, and there are different levels of that connection, connection. So the tryptophan actually it metabolized by the guts, which I'm going to come, by microorganisms in the gut, that their metabolites and they reproduce serotonin. Serotonin travels through the rest of the body, and that's why it's important. So, and I'm going to go quickly on those. So, tryptophan, where do we find tryptophan? Well, I just said it. Lamb, we had just meat, and we have chicken and turkey. And somebody else here told me that they work with chocolates, and she was smiling. I'm like, no wonder you're smiling. Somebody here in the audience, and they found also dark chocolate, but it has to be 70% cocoa, okay? Protein is important for the immune system. And also, we'll find out also, I'm going to go through this quickly. Next, so that we talked about the protein, all right? Let's talk about omega-3 fatty acids. I think you've heard a lot about omega fatty acids, how it is a protective, and people take the omega-3 fatty acids. Sometimes people say, how about 3, 6, and 9? You know, just focus on omega-3 fatty acids. How is it related to depression? Well, one of the things, omega-3 fatty acid is way even before you were born. Even when it really started when your mother was pregnant, because it's an important component, crucial for the brain function. It has a role in the neuroinflammation, neurogenesis, and neurotransmission. And as a matter of fact, it's a long chain of those amino acids. And those are involved on the brain itself. Brain is fat, by the way, and it has the cell walls. And that's what makes it, those kind of the chain that makes the brain. So it's very important that they find out, since so if you have a cell and cell wall, the conduction of transmitters will be good, right? And also it's involved So involved in the conduction of that, involved in the mitochondria, the cell wall as well. And they found out actually deficiency of omega-3 fatty acid. They did a study, they call it the Dutch study, the Dutch depression study, and they found out there is a link between that. The people who have a good level of omega-3 fatty acid, they have the risk of their depression less than those who are deficient. So people with a normal level, they have a better, they say prevention, or they have lower risk for depression than those who are not. Now, there were many other studies, but we have now in US, the College of Psychiatry now, with everybody who's taking the medication and who is also taking the psychomedications. They ask them to take between 1 to 2 grams of the omega-3 fatty acids. And just FYI, some people, I get asked for this question all the time, like what is the ratio? So you have to look for the ratio of, never mind about other things when they put fillers. You have to look at the ingredients quite well, because the ratio is very important. It has to have about 60%, at least 60, the EPA. And again, it's 1 to 2. If you want to take 3 or 4, you can, but you have to make sure that you are not in other medication, especially, for example, Coumadin or heparin, because it involves in the thinning of the blood. So make sure of that, and always ask your physician that you're under, if you're a cardiologist, or that you're going to take that amount. The next thing, the other slide that I'm going to is, is it vitamin D? Let's see, vitamin D. In vitamin D, not only that, vitamin D is important for the bone and the teeth, but they found out that people who are low in vitamin D levels is associated with people who have depression. But doesn't mean that when you give people, you are depressed, you get more vitamin D, they're going to be less depressed. It's just association. It was observational studies, and it's amazing how vitamin D is related to depression, because actually vitamin D, it does have a role for the production of the whole spectrum of neurotransmitters. And you don't want to have one transmitter over the other. You need to have a balance of all those neurotransmitters. Where do we get the vitamin D? Sun. Okay, but in Florida it's hot. Where do we get then we don't go under the sun and then tell you about the cancer, the skin cancer. Where do you get it? Huh? Green peppers? Well, again, the vitamin D, mainly it's a fat-soluble vitamin. So you have to think about fat-soluble vitamin. So the best things is the fatty fish. Mackerel, tuna, sardines, salmon, all those are, and also fortified products like dairy products. It has a vitamin D. But don't tell me you're going to take skim milk and you're going to get vitamin D, even though it will be fortified, because vitamin D would not be absorbed well unless you have environment of available of fats. And that's why sometimes, I do see patients that they come and say, my level is low and I'm taking vitamin D. When do you take it? I take it first thing in the morning. With what? Water. Are you going to eat? Yeah, I'll take 2-3 hours after that I eat. No wonder, because you need fat with that. Okay. Now, we have other things. Did I skip something? Vitamins, I'm going to go quickly, or maybe I should take this. Prebiotic and probiotic in the gut microbiome. I kind of mentioned this because this is very, very important. There's so many studies now is going on. Your gut, the gut, the brain, and the association between that in different levels between what you feel. Sometimes you're like, oh gosh, I'm going to have a test. I'm going to give this lecture. I feel kind of butterflies my gut, it's true, or a gut feeling is true because they communicate. So can somebody tell me what's prebiotic, probiotic? What's probiotic? Anybody taking probiotic? What is it for? Okay. Huh? Oh, okay, yeah. So your gut, it has like billions of organisms made, and it's diverse. See, the gut love diversity. Virus, fungal, bacteria, okay? And it has good bacteria and bad bacteria, but hopefully it's a good bacteria. And those called probiotic. Where do you get them from? This is why it's important, because you're going to see them. They are the ones responsible for producing in the production of the neurotransmitters, especially the serotonin, the happy one. The one who's responsible. If we don't have enough, we're going to end up with depression, okay? So those bacteria, when they get the tryptophan, they metabolize, the tryptophan, and then they produce serotonin. And from serotonin, you get melatonin. So you get rested, you get be happy, and then your sleep. Dr. Adel talked about the importance of deep sleep. Okay, people who are depressed, they're not going to have a good sleep. That's the first thing. The next day, because you don't get good sleep, what's going to happen? Sloppy, tired, nervous, can't concentrate, depressed. Okay. And then the vicious circle keep going, okay? We need to break that. So that's one of the things. Also for the immunity. So those bacteria, good bacteria, what do they do for the immunity? They're metabolites. They produce something they call it short chain fatty acids. And those are the lining of your guts. And that's where the theory came is leaky guts. Have you heard about it? It is, they don't have the diagnosis as the CD10 for the insurance companies yet, but it is in theory, okay? It is the leaky gut. What does that mean? That means your gut permeability, there's a permeability, so if you have some germs or anything, it will go through. You have toxins, it's going to go through your body, okay? Do you see that? So those are your friends, those are bacteria. And also, there is also association between that and also the colon cancer. There are some studies to show that as well. So the good bacteria and the bad bacteria and what we have, where do we get those flora or what they call it, the organisms? Where do we get them to start with? Are we born with them? Who said yes? You followed your gut feeling. You have healthy guts. Absolutely. From the gut. So basically, when the babies are born, let's say the baby is born through normal delivery. The babies usually, what do they get? Amniotic, the fluids from the mother. But that's where they get also the flora of the mom. So that is the first thing that the immunity going to have. That the immunity going to tell the baby what's good and bad and what is going to hurt them and not. This is the first incidence. And that's why when you compare it with those people with the C-section, sterile environment, the baby is born, need to build that immunity. Okay? So for sometimes, that's why people who born normal delivery versus C-section, you see those have better immunity than the other. Okay, same thing with the breastfeeding. Bottle or breast. I don't want to gain weight. Give them bottle, but hey, your baby's going to get sick for the coming few years. They did not build the immunity. Where is it coming from? The mother, and that's where the flora. So the flora is so important, and why it's important is depression. They did animal studies. They put mice and also human mice. They kind of sterile their guts. They killed they killed the bacteria there, and they brought somebody who is depressed. They found that depression, people who have depressive disorders, they have less of that, and they have more of the bad bacteria. So they brought samples of that, and they put it in the rodent or in the mice. The mice show the behavior or depressive behavior symptoms. And that brought us to the new generations. If somebody here, they've heard about it, is fecal transplant. So people like sometimes, and for a long time, I remember any patients come with the IBS, I'm going to the dietary and things, and the doctor said, there's something wrong with their brain, don't spend time. Now they're finding, no, it's not something wrong with their brain, it's something wrong with their gut. And so now with like ulcerative colitis, Crohn's disease, IBS, SIBO, this is overgrowth of bad bacteria. Now they are doing things what they call fecal transplantations. Really, they have some people and some patients, when you told them, say, no, that's gross, I won't do it. But actually, it is successful if they know how to do it, and they do it, and they follow after. They take like the fecal from a normal person, good bacteria, and they have like the mixed diversity to somebody who is, they have all those problems, symptoms, and the success is really high. But it's very important that the patients need to follow after that. It's not a procedure you've done and that's it. You need to follow a certain diet and certain supplements. It's all change of your behavior, eating behavior. So, I'm going. So now, do you get the idea of and the thing is, what can I feed? How can I have a good gut? How can I be a gut feeling? I want to have a gut feeling all the time. I want to have a gut feeling, say, where's my son is, or I want to have a gut feeling, my husband is not here yet. I want to have a better healthy. How can I feed those bacteria? Does anybody have any idea? Huh? Yes, absolutely. Whoever said the yogurt. I bet he has also a good, healthy gut. Right. So each countries, and if you see the world, they have things that kept that. Yogurt, also kefir, sauerkraut, kimchi, kombucha, but be careful. Some of them have a little bit of alcohol. So just saying. What else? Kimchi, that's right. Yeah. So pickles, fermented, any fermented food too. All right. So why? How that? So the fermented food is good, but also there are foods that feed the bacteria. I need to feed the bacteria. How do the bacteria feed? In a good fibers. Okay? The fibers that we find where? We talked about the Mediterranean diet. So what do we are talking about? From where? Nuts. Olives. Vegetables and fruits. Okay? There are some spices as well. All those onions. So most important, garlic, onions, leeks, artichokes, most of the like whole grains, oats, all of them, they have those fibers that feed those bacteria. They thrive when they have that, okay? They thrive and then they can do their job. But I want to, there's something I want to mention is important. I need to bring also something from the Sunnah. And following the Sunnah, not only you benefit yourself, but also you have to put your mind, when you follow the Sunnah, you get ajr, right? And one of the things, through the Quran, and also you kind of, through the Sunnah, you keep saying honey. I'm like, okay, it's important to know why is honey? It's mentioned there. But before I get there, what kills those bacteria? What makes the bacteria thrive, the bad bacteria thrives? Sugar. Sugar kills it. Sugar kills the bad bacteria, and then the good bacteria and the bad bacteria take over. Antibiotics, that's number one. We give the kids from the pediatric and the antibiotic. I see some of my patients, IBS, every few months they are on antibiotic because of the UTI or this and this and that. No wonder they don't have the bacteria, it's wiped, Antibiotics, what else? Sugar, fried food, the saturated oils, kills it. Alcohol, wipe it. Okay? Alcohol, smoking as well. They kill. And then what do you have? Oh, other things as well. There is also some of the studies that people who are on long omeprazole and the anti-acid this and the reduction of the acids, then we end up with the bacteria overgrowth. Do we see bacteria overgrowth? Yeah, we do see it. And patients come and they do procedures, they do colonoscopy, they do EGD, they go up and all kind of tests. And they come and say, I don't feel well. I have bloating. I have gas. I feel tired. My body in pain. I gain weight and I don't eat. And they are in tears. They're depressed. Okay? The doctor said there's nothing. Maybe they need psychological things. But when you look at the things, they have SIBO. And then they have also, and if the same thing with the IBS. You need to correct that. But a lot of times, and even myself, and I start to question that. And that's why when we said, what's your knowledge about nutrition versus this, I put 9 out of 10, even though I'm giving a lecture. Because this is take me to things like, for example, we, according to evidence-based, we're treating patients with a low-fat MUP diet. Everybody heard about that low-fat MUP diet. But this, it will exclude many vegetables, excludes many fruits. It includes like things that you need for the good bacteria. Maybe there's another way of doing it. Maybe kill all the bacteria and start all over, okay? But most important thing, what the brother said, patient. You have to be patient. You have to go through pain. You need to do this. You need to do that. You need to follow those diet. But this is going to give you pain. But this is the only way you can kind of counterclock what happened to get that a good thing. So just to say prebiotic, probiotic. Prebiotic is what you feed the bacteria. Probiotic are the bacteria. Sometimes if you travel, sometimes you're sick, sometimes after antibiotic, take probiotic and take those food with the probiotic. Okay, that it comes to the next vitamins: B12, B6, folic acid. Absolutely, they are. I know I'm going to cut it. B12, B6. My son is there and tell me this. B12, B6, folic acid is very important for the function of the neurotransmitters. Now, even you see from the study how B12 deficiency linked to depression, B6. Nobody, like people say B6, yes. Those who are taking contraceptive pill, they have to take B6 because they've found out the women who are contraceptive, they're depressed. But they found out the level of the B6 is low. So supplement of that, the B6, because this is responsible for the serotonin and the GABA, and this is for the happy. Folic acid is the same thing, and we want to prevent, okay, next. Okay, the key minerals are magnesium, zinc, selenium, copper, those are very important, you can see that. And the practical takeaway from this, we need to have a balanced diet. You need to have a good quality protein in a meal. And when I talk about protein, could be vegetarian protein, could be animal protein. But people who are the vegetarian, they have to do it correctly because they found out that the incidence of depression among vegetarian is higher than none. And especially if they are not mixing the right protein together, they have to complement each other. If they don't, they're going to have a problem. Second thing, focus on the tryptophan, food rich in the tryptophan. Now, omega fatty acid, the B vitamins are all essential for your mood. And so to beat the mood, I mean, to kind of decrease the risk for depression and also in conjunct with the treatment and psychotherapy of depression. And very important to kind of extreme low protein restrictive diet. And we see that, for example, people who have like gastric bypass, losing a lot of weight and things, they will end up with depression because of those nutrient deficiency in their system. Thank you so very much for attention. Thank you. Thank you.